One of the most exciting approach in these years for patients with MPNs generally that would have a calreticulin mutation that is basically present in about 25% of patients with essential thrombocythemia and about 30-35% of patients with myelofibrosis, is targeting or directly attacking the calreticulin mutations and removing it from signaling. It has been shown that mutant calreticulin as a driver mutation causing essential thrombocythemia, myelofibrosis, and being responsible for its disease manifestation and progression could be targeted, what we call a way of finding a mutation in the body by delivering drugs, locking or using a drug that's gonna basically lock on the surface of the receptor and block it from exerting its efficacy. So the first data were released on essential thrombocythemia. This abstract was shown on ASCO. Again, this summer had quite huge MPN talks that released first data on 49 patients across 2 studies in high-risk essential thrombocythemia in the second-line setting. So patients had to fail first-line therapies for ET. And then it showed basically in the first-in-human early phase that has to go through what we call dose escalation. So we have to find a dose that will be safe and effective and would not impact patients in a negative way. Already very promising efficacy and excellent safety profile. Here we had only data on a very short monitoring, so what we would name a median follow-up, so how long would median these people we follow, was only about 6 months and a little bit more. So we need more durable data to be coming to see a larger impact. And again, it was a dose finding, so different doses across patients enrolled. Nevertheless, safety has been tremendously amazing. There were no significant limiting toxicities, no extremely concerning compounds, which is a very important signal for a first-in-human clinical trials in such a setting, that nobody has been able to attack calreticulin ever for these patients. And then efficacy, despite the limits of early phase, short follow-up, different dosing, high-risk patients, has been also very, very, very promising, with more than 80% of patients achieving control of their blood counts, 87% on higher doses. And more importantly, this study, because it is specifically targeting the calreticulin, is looking at how many of these calreticulin percentage cells would be decreased with the specific targeting. So how many of them would be induced dying? And it was noticed in almost 90% of patients, despite the short follow-up, and more than 20% of patients would have significantly more than 50% reduction. This is actually never heard of a result in an early study. We hope that safety will hold as more patients are enrolled and more data are coming in, because the mutant calreticulin approach, as it currently expanding in the myelofibrosis and different approaches by different companies, vendors, and sponsors, made actually changed the way we address or treat patients with calreticulin mutated myeloproliferative neoplasms, irrespectively of the category of essential thrombocythemia, myelofibrosis. Just mutation would basically makes them targetable. So exciting time here. Anybody who is in the space and who wants to get an update, this is definitely one to follow. And we already are seeing a lot of new companies and new entering the field. So we'll be watching for safety, efficacy. It'll take us a couple years to get it more available, but this is a very promising, hopefully turnaround to patients that suffer with this devastating disease.